Welcome to Learn Chemistry Together. This video is about Tofacitinib Xeljanz. Tofacitinib, commonly known by its brand name, Xeljanz, among others, is a prescription medication classified as a Janus kinase (JK) inhibitor. It is used to treat certain chronic inflammatory and autoimmune conditions. What is Tofacitinib used for? Tofacitinib helps modulate an overactive immune system to reduce pain, swelling, and inflammation. It is prescribed for adults, and in some cases children, to treat rheumatoid arthritis, RA, usually when other medications such as methotrexate have not worked well enough. Psoriatic arthritis, PSA, to manage joint pain and skin-related inflammation. Ulcerative colitis, UC for moderately to severely active chronic inflammation of the colon. Ankylosing spondylitis, AS, a type of arthritis that affects the spine. Juvenile idiopathic arthritis, JIA, for specific pediatric populations. How does it work? In autoimmune diseases, the body's immune system mistakenly attacks healthy tissues. JK enzymes, specifically JK1, JK2, and JK3, act as internal signaling messengers that trigger this inflammation. By blocking these enzymes, Tofacitinib interrupts the signaling pathway, dampening the immune response and slowing down tissue damage. Common side effects. While taking Tofacitinib, some patients may experience mild to moderate side effects, which can include upper respiratory tract infections, like a common cold or sinus infection, headaches, diarrhea or nausea, elevated blood pressure or cholesterol levels. Important safety considerations and warnings. Because Tofacitinib suppresses parts of the immune system, it carries several critical warnings. Serious infections. Patients are at a higher risk of developing severe infections such as pneumonia, tuberculosis, TB, shingles, herpes zoster, or fungal infections. Screening for latent tuberculosis and other infections is typically required before starting treatment. Blood clots and cardiovascular risks. Use of JK inhibitors has been linked to an increased risk of blood clots in the veins of the legs, deep vein thrombosis, or lungs, pulmonary embolism, as well as major adverse cardiac events, like heart attack or stroke, particularly in individuals with pre-existing risk factors. Malignancies. There is a potential rare risk of developing certain cancers, including lymphomas and skin cancers. Lab monitoring. Regular blood tests are necessary during treatment to monitor complete blood counts, liver enzymes, and lipid profiles. Vaccinations. Live vaccines should generally be avoided while taking Tofacitinib. Disclaimer. This information is for educational purposes. Always consult a qualified healthcare provider regarding specific medical conditions, dosage instructions, and potential drug interactions. Thank you for watching. Click subscribe for more.